Hello again. I'm Patrick Hendry, Vice President of Peer Advocacy, Supports and Services at the National Office of Mental Health America. And I really want to welcome you to the third session of Peer Partners in a Box. Today, we're going to talk about recruiting members for a new program. The eligibility requirements for peer partners are relatively simple. Need for services is determined by completing a personal outcome measures interview. You have to be at least 18 years of age and competent and able to give informed consent. You also need to be able to manage personal finances, establish goals and action plans. And you have to be willing to adhere to all agreed upon participant responsibilities. Getting the word out about a new program is really important. You want to create a one-pager or an introduction letter that tells possible candidates for the program what it's like, how it works, and then also explains it to some of the other groups that might promote it for you. You can use easy graphic tools like Canva to create flyers and social media posts. And you want to share all of the information you have with other peer support organizations in your community, advocacy organizations, and even provider agencies. Starting a new peer partners support group can be pretty confusing. It's really important that you realize all of the details that you need to attend to. For instance, you want to talk to other people in your agency or community and let them know that you'll be starting a new group. You want to invite others in your own agency or organization to brainstorm with you. If you're holding this program in a space that you might be sharing with other programs, it's really good if you get the buy-in by providing dates, times, and who will be attending the support groups. Consider what other resources you may need, such as a variety of snacks, writing materials, posters, anything that might be needed during the support group sessions. Also, consider logistical arrangements like the transportation needs of the group. Another really important thing to consider when you're first starting a group is location. So you want to think about things like accessibility. And remember, every person is unique. So you got to consider that for a lot of people, this is a big step. Change can be difficult. Familiarize yourself with all of the forms and guides and the Peer Partners Manual before you start the program. Mental Health America provides all the documents that you will need for the program, and there's quite a lot of them. The MHA Support Group Facilitation Guide, Peer Partners Peer Life Coach Handbook, Personal Information and Consent Forms, Personal Outcome Measures, Inpatient History and Hospitalization Information Records, the My Social Starting Point pages, Making Social Stride pages, Setting Social Goals, our guided journals, quarterly goal accomplishment plans, social spending plans, social budget tracking, social assessment evaluation, special evaluation like grievance forms, an exit interview, and a satisfaction survey. This sounds like a lot, and in some programs you might not need every one of these things. You can customize your program as you go through it, because the really important thing is that it works for the people participating. So these forms and journals can be modified for your specific program. These are some of the really important points that you need to remember when you're starting up a group. Participation is always voluntary. So if someone tells you that they've been told they must attend the group, make sure that you have a conversation with them so that you really know that they want to attend the group. Confidentiality is always important. The HIPAA guidelines are part of it, but peer programs tend to go even further. You want to make sure that anything said within the group, anything written as part of the program, are always kept absolutely confidential. Maintain professional boundaries as defined by your agency or by your peer support certification. You want to look to make sure that there's appropriate use of social budget funds and the requirements for keeping records. Remember, all expenditures must correlate to the social goals, action plans, and social budget. Changes must be made with the facilitator's input. I really want to thank you for joining us in part 3 of our Peer Partners mini webinar series, Recruitment. So check out part 4 in our series on personal outcome measures.